Hey, good morning. So already, Toronto Public Health starting to make plans for the 5 to 11 age group to get vaccinated, but with no word yet on when that approval is coming. How long until we can expect our kids to get their shots? To discuss that and so much more, infectious diseases physician, we welcome him back, Dr. Isaac Bogoch. Good morning.
Hey, good morning.
Nice to see you again. All right, let's start with the school setting. We're following the numbers. We're 3 weeks to a month into school, and we're seeing some cases, as expected. Dr. Eileen Davila with Toronto Public Health saying, let's add it to the list of mandatory vaccinations. Of course, that has to happen through the province. Are you in support of that?
I mean, this is a tricky one, right? Because some parents are saying, absolutely, if my child is eligible, I'm totally getting my child vaccinated. And many of those children who are 12 years and up have already been vaccinated. Of course, there's many other parents that are saying, let's pump the brakes a little bit. I have a few questions. I have some concerns. We recognize that these are still, relative to other vaccines, kind of new and have other questions. I think we need to really alleviate a lot of parents' concerns about these vaccines. Of course, I'm in full support of this vaccine, and I think it's fantastic and is transforming our epidemic and keeping schools safer. The more people that are vaccinated, the better. But this is going to be a challenging and polarizing issue because we know that there are still some side effects of the vaccine, however rare they may be. We still have to acknowledge them and discuss this in an open and transparent manner, but also discuss the tremendous benefits that this vaccine affords both the individual and, of course, the close contacts like the family, and then, of course, the community at large. So it's going to be a tough conversation moving forward with this one.
It feels almost tougher when you look to that 5 to 11 age group because they're so much younger. We're hearing a timeline of possibly by Christmas it could be approved by Health Canada. Are you hearing anything further to that?
No, I mean, we know that the early clinical studies have now been complete. We know that the company is providing all the data to the regulatory agencies like Health Canada, who will either give it the thumbs up or the thumbs down. I think it's likely that this will be approved in Canada, probably in the latter part of 2021 and maybe at the latest, the early part of 2022. But it's wonderful to hear that Toronto, for example, is already getting prepared. I mean, they're expecting this to be approved and they want to hit the ground running. They're already talking about getting engagement from schools and communities and public health and everyone involved so that when it is approved, they can administer this right away so that there's no delays. And again, like we can talk about the safety and the efficacy of the vaccine, which I think is going to be just fine. But I think that this will have a significant impact on the epidemic and really help create safer schools, safer communities when it's unrolled.
Dr. Bogoch, later today, we're expected to hear projections, COVID-19 numbers in the province, and we've been below that 1,000 mark for some time. Does this indicate anything to you? I think you sort of implied it when it comes to vaccinations, but where do you see this going with numbers?
Yeah, I mean, we're doing well now. There's no other way to put it. I mean, it's wonderful to see Ontario doing as well as Ontario is at this point in time. And when you look at the models from about a month ago, they always release a best case scenario, worst case scenario, and then a mid case scenario. And quite frankly, it's a bit of choose your own adventures, right? Where you land, which scenario you take is really dependent on the policies that are enacted at the province and community level, and then, of course, how people adhere to those policies and some individual responsibility that's taken as well. Of course, it's a combination. We've done well so far. The modeling is probably going to be more of the same. Here's what happens if we do nothing and stop all public health initiatives, and you'll see a really nasty case scenario. Here's what happens if we continue on this path. And, here's a midway, scenario as well. I think it's fair to say that you still have to take this seriously. It's still very early in the fall. We've got a long fall and winter ahead of us. There's ample opportunities for this virus to be transmitted in indoor settings as kids are in school, as people go back to work, and as we hang out more and more inside. So, expect to see some peaks and valleys of this virus throughout the fall and winter. But we have the tools. We have the tools to keep this in check. We know how to keep indoor environment safe with masking, with ventilation, with crowd control. We have a safe, free and widely available vaccine that's extremely effective. I mean, we have the tools to keep this at bay.
Okay, and let's continue on that path. Dr. Isaac Bogoch, as always, appreciate your time. Thank you.
Have a great day.
You too.